For all, and tonight you've released a very detailed plan.
Just all that
2 hours.
The Republican attitude towards the healthcare is get a good job and hope that your company buys you healthcare or pays for your healthcare. And if you don't get a good job, well, then you're a lazy scumbag and just die. Or, pay for the $350 plan a month yourself. And if you don't have the money, well, that's your fault. You're a scumbag.
Hours before the debate, you did. But let me ask you about Vermont, because in Vermont, you tried.
But then these Democrats, they're insane because they like this guy thinks that they're a bunch of global warming nuts.
The state of Vermont, and Vermont walked away from this.
And like on these social issues, they're insane. It's
kind of idea of Medicare for all, single payer, because they concluded it would require major tax increases,
you might
and by some estimates it would double the budget. If you couldn't
Andrea,
sell
let me
it in
just say
Vermont,
this. Let me
Senator,
just say that
how
you might
can
want to
sell it
ask
to
the governor of
country?
the state of Vermont.
Well, yeah, it would cost more. It costs money to insure. For everyone to be insured, it's going to cost a certain amount of money. So what she's saying is, well, let's not take care of some people. Let's put, without health, then all these other programs don't matter. Like, you could cut the Department of Education, just make private schools, in other words. You could give people, there's ways to cut the cost, in other words, to make it available.
Why he could
You
not
need the political will to do it. That's the only thing that's lacking.
do it. I'm not the governor. I'm the senator from the state of Vermont. But second of all, here is what the real point is. In terms of all of the issues you've raised, the good questions you've raised, you know what it all comes down to? Do you know why we can't do what every other major country on earth is doing? It's because we have a campaign finance system that is corrupt. We have super PACs. We have the pharmaceutical industry.
The reason why we can't pass these laws in the Senate and the House is because these politicians are owned by these interests, and then it's not in these companies' best interests, to insurance companies, pharmaceutical companies, for the government to come in and start, cutting costs for these on their end, or cutting their profits, regulating how much the pharmaceutical companies can charge or what they're selling. Conflicting
Pouring
interests.
hundreds of millions of dollars into campaign contributions and lobbying, and the private insurance companies as.
Why would a pharmaceutical company, donate money to a politician so that they'll pass laws favorable to the pharmaceutical company? Same with an insurance company.
Well, what this is really about is not the rational way to go forward. It's Medicare for all. It is whether we have. Corrupt. We have super PACs. We have the pharmaceutical industry pouring hundreds of millions of dollars into campaign contributions and lobbying, and the private insurance companies as well. What this is really about is not the rational way to go forward. It's Medicare for all. It is whether we have the guts to stand up to the private insurance companies and all of their money and the pharmaceutical industry.
She's like, I don't like his argument, because she's not trying to win votes by appealing to people's logic. She's just gonna say, oh, I'm just by I have no idea how people elect people like that.
That's what this debate should be about.
Well, as someone who has a little bit of experience standing up
I have experience. I've been in politics all my life.
to the health insurance industry that spent,
See, now she's saying, hey, I'm not I'm the one that's trying to fight the health insurance industry, not Sanders. Sanders is the one that, but the reality is Sanders saying, let's just get these people out of there. No more for-profit middlemen. And so even though she's really working for them, because that's how Obamacare works. These companies get richer. Now she's going to make the case that she's really working against them.
Many millions of dollars attacking me, and probably will.
This idea that the CHIP program, like that the private insurance companies were so against it, in other words, is not necessarily true, because it was probably the Republicans that were more against it because it's a big government program.
So again, because of what I believe we can do, building on the Affordable Care Act, I think it's important to point out that there are a lot of reasons we have the healthcare system we have today. I know how much money influences the political decision making. That's why I'm for huge campaign.
He understands already why the system is the way it is. He explained it. Now he's saying, let's change that.
Finance reform. However, we started a system that had private health insurance, and even during the Affordable Care Act debate, there was an opportunity to vote for what was called the public option. In other words, people could buy into Medicare. And even when the Democrats were in charge of the Congress, we couldn't get the votes for that.
Why? Also, these people weren't voting on a Medicare for All program. They were voting on some sort of addendum to the Affordable Care Act, and it's a different type of issue.
So what I'm saying is really simple. This has been the fight of the Democratic Party for decades. We have the Affordable Care Act. Let's make it work. Let's take the money.
So in some states, they were going to make their own little websites. And like in Oregon, they try to make their own website, and no Oregonian was ever able to enroll online in a private plan under the Affordable Care Act because the state exchange never had a functioning website, forcing insurance seekers to file paper applications. And then so the state hires a company to, create this website. Oracle Corporation here, which was hired to create the exchange, sued the state agency in charge. The company alleged a breach of contract and accused then Governor John Kitzhaber of attempting to vilify the company in the media. I guess what they're saying is we want to get paid for what we were promised to do. We did it, and then the state responded with a lawsuit of its own, accusing the Redwood City, California company of lying to Oregon officials, failing to deliver on contracts, and filing about $240 million in false claims. See, the problem with the Affordable Care Act is it's logistically, it's a bad idea from the start, but logistically it's not working for several reasons. Incompetence. In order to make this operation go into effect, you need someone that can know a manager, like a
corrupt.
And there's no one smart enough in the Democrats to know, to look at the different problems that might arise, or, they create a system that is doesn't work very well.
We have super PACs. We have the pharmaceutical industry pouring hundreds of millions of dollars into campaign contributions and lobbying, and the private insurance companies as well. What this is really about is not the rational way to go forward. It's Medicare for all. It is whether we have the guts to stand up to the private insurance companies and all of their money and the pharmaceutical industry. That's what this debate should be about.
Well, as someone who has a little bit of experience standing up to the health insurance industry that spent,
in addition, what these lawmakers wanted to do with the Affordable Care Act is they wanted to get people trained like enrollers or people to help other people enroll on the government site, like to stand over them and, help them go through the process. But these people aren't even licensed agents, so they're just trying to they don't ask for the agent's help or bring the agent into it. They're kind of like just like the agents don't exist. Navigators. See, he tries to get these people to work for cheap for, $7 an hour or whatever, and that way they don't have to pay them what insurance agents make, which is, a commission, so forth and so on. They don't want, like this. They see. They don't want the doctors to make money. They don't want the insurance agents to make money. But they want the insurance companies and so forth to make money. It's not really like communism. It's a type of a corporatism